Good morning. Delighted to be here with you and Senator Nelson. You hear me talk quite a bit about the strong economy in Texas and our financial condition, but I want to talk this morning about what I think is an obligation of government to reach out and help those people in our society who truly cannot help themselves. The elderly, frail, disabled, children. Since I became lieutenant governor in 2003, during that biennium of 2002 to 2003, we've seen our cost with health and human services go from 20% of our budget in general revenue to 30%. We've seen our Medicaid cost double during that time period. So today, and I've been warning that this day would come, we're seeing crowd out in our budget of services that the people of Texas want to see. Not only public education, but higher education, public safety, transportation, etc. But we still have an obligation. We still have an obligation, I believe, to help people who truly cannot help themselves. And so we're going to have to focus, and that's what Senator Nelson and I have been working on for a number of different sessions, free market reforms to Medicaid and to health care, so we can provide health care more efficiently, and we can fight and root out fraud and abuse in Medicaid. That's why it's been so important that we work together and provide these different reforms. Last session in 2011, our reforms through Senate Bill 7 that Senator Nelson authored realized $2 billion of savings for Medicaid while keeping the quality of our health care high. But we can't stop there. Senate Bill 7 also had a free market reform element that Senator Nelson had authored that provided for the first time in the history of the state of Texas a provision so that physicians and hospitals can come together and negotiate incentives to have better outcomes, to follow best practices, and to keep people healthy and out of hospitals. We're going to have to continue these free market reforms, and that's what we're going to talk about in just a moment, if we're going to be able to maintain the health care that our people need, who need help, at the same time not have crowd out in public education and higher education and our different services which the people of Texas want. Senate Bill 7 and Senate Bill 8 by Senator Nelson are two important bills that give the Health and Human Services Commission the tools and the direction that they need to fight this problem. Again, we want to build on what we did in 2011 with Senate Bill 7. And Senate Bill 7 continues to advance many of the reforms that we have started to provide more efficient delivery of health care, incentives to provide better health care, to follow best practices. But we apply this to Medicaid. And Senate Bill 8 gives the Commission, the Health and Human Services Commission, the tools they need to fight fraud and abuse. These are very big challenges for all of us, and I appreciate the leadership. I appreciate the hard work that Senator Nelson has been doing in this field for years. Senator Nelson, thank you so much for everything you do.
Thank you, Governor. Well, and thank you all for being here today. Good morning and welcome back. I think I've seen most of you since we've begun. And I want to thank Lieutenant Governor Dewhurst for your leadership on these issues and for providing our Health and Human Services Committee a very long list of interim charges that helped us develop critical solutions to our health and human services challenges. We find ourselves in a much stronger economic position than last session, thanks to a state economy that is outperforming the rest of the nation. Thank you. And that means that we're better equipped to serve our citizens, but we still have major problems that we have to address this session. One of them is fraud in the Medicaid system. And I have to take right now to tell all of you media who have had these investigative reporters uncovering these problems, thank you. But it's depressing. Yeah, I said at a hearing, Governor, that I feel like we're playing whack-a-mole. We have one problem uncovered and we try to deal with it, and then we see another one emerge, and I appreciate the media's attention, but we have to assume our responsibilities and head off some of these problems before they begin. With a tight budget and trying to find the money to serve those who truly need our help, Governor, right. It is infuriating to hear report after report of the kind of abuses that are taking place. The problems are particularly serious in Medicaid dental, orthodontia, transportation for our Medicaid patients, but really it's everywhere. According to the Federal Office of Inspector General, it's at epidemic levels. Here in Texas, and I asked my staff today, I said, are you sure this number is right just for Texas, or is this federal? In Texas, the Office of Inspector General has identified more than $6 billion in fraud and waste between 2004 and 2011. We cannot afford to be losing a single dollar, let alone that amount. When you defraud the system, you are stealing from the taxpayers, from children, from the poor, the elderly, and Texans with disabilities, those Lieutenant Governor talked about, who are truly in need. It is a crime against our most vulnerable citizens, and we have to change our approach to stopping it. Under the current system, all too often we uncover systemic abuse weeks or months after the services have been delivered and money's left our Treasury. That creates problems not only for the state, but for the providers that have to go back into their archives and comply with fraud investigations. We're going to change that. This morning, I filed Senate Bill 8 with the goal of focusing more attention on the claims data much earlier in the process. And we hope before the damage adds up into the millions, as we are unfortunately seeing today. Senate Bill 8 directs the Health and Human Services Commission to develop a program to identify outliers, anomalies, and red flags in the Medicaid program so we can deal with those abuse trends on the front end. It will not only prevent lost revenue, but it will also make the investigation process work more efficiently for all parties. Here's some details about Senate Bill 8, and we'll have a handout for you, but it validates the Office of Inspector General's authority to detect, investigate, and prevent fraud, waste, and abuse across all of our health and human services programs. It clarifies that a provider is ineligible to participate in Medicaid once a court finds the provider liable for Medicaid fraud. It permanently excludes providers who have been excluded or debarred from another state or federal health care program for fraud or injury. It strengthens the prohibitions against solicitations for Medicaid clients. We heard story after story about that, and we are going to prohibit that and make sure that that does not take place. It places the medical transportation program into a managed care setting, and it directs the Health and Human Services Commission to reduce inappropriate use of ambulances for non-emergency services. In addition to reducing abuse, we also need to build, as our Lieutenant Governor said, on our previous efforts to improve the quality of Medicaid, of our Medicaid system, and that includes, and especially this session, our long-term care. Lieutenant Governor Dewhurst started quite a number of years ago talking about this, and Senate Bill 7 last year not only saved us money, but it improved outcomes. And we're going to build on Senate Bill 7, with a new Senate Bill 7, by the way, and focus on, again, improving outcomes throughout Medicaid with a particular focus on our seniors and our Texans with disabilities. And again, I have to thank Lieutenant Governor Dewhurst for placing so much attention on this. It's very, very important. Now, our population is continuing to mature. It is vital that we ensure that our seniors are receiving high-quality care, that our programs are financially sustainable, as more and more Texans reach our golden years. Texas has the highest, our nation's highest percentage, our largest senior population in the nation. Seniors make up the fastest growing age group in our state's population. The number of Texans 60 and over is expected to grow from 14% of the population today to more than 20% in 2040. As our population grows, so does our demand for services for Texans with disabilities who are living longer and more productive lives than ever before. It is important that we're ready for the impact that both phenomena will have on our long-term care services. It's coming, and we need to be prepared for it. Under the current system, the number of individuals, we have a very limited number of individuals with disabilities who have access to an extensive array of services, some of which they don't use, by the way, or may not need. Meanwhile, we find others who are waiting months or even years for even very limited basic services. Our goal is to reach more individuals with services that will improve their quality of life and help them live independently rather than more costly institutional settings. Our goal with Senate Bill 7 is to reach more people with quality, effective services. Specifically, it redesigns the long-term care services for individuals with intellectual and developmental disabilities. It directs the Health and Human Services Commission to develop quality-based payment systems that will reduce unnecessary services and improve outcomes for patients in the Medicaid long-term care system. It strengthens requirements to ensure that quality-based payment initiatives apply in managed care. It expands managed care throughout Medicaid, including services that are provided in nursing facilities. These are some of the most vulnerable people that we serve. We need to make sure they get the best possible care and that we're delivering services in a way that ensures that we keep caring for them in the future. Lieutenant Governor Dewhurst, you're right. Both of these bills are very important, and I am so grateful that we had an opportunity during the interim to focus our attention on this, and I think we developed a package here that is going to truly be beneficial to the Texans.
I think both bills are very, very good.
Thank you.